Hi everyone, welcome to our video for diabetes mellitus type 1. So to begin our video, we're going to discuss the normal person versus the person with diabetes. So in the normal person, the pancreas has beta cells, and these beta cells create insulin. So let's pretend that you just ate a really good cookie. So your body is going to have a bunch of glucose in your blood, and you're also going to have insulin. So your cells have insulin receptors, and when insulin attaches to those receptors, it facilitates glucose uptake into your cell, and your cell has energy, and there's not going to be any glucose left in your blood. In the abnormal person, there's not going to be those beta cells or there's going to be very few of those beta cells because your body recognizes those beta cells as foreign, and therefore antibodies attack them. So you're going to have all that glucose remain in your bloodstream and none's going to go into the cell because there's no insulin, and that's not good. So, how do you get diabetes type 1? Well, it's commonly diagnosed in kids and teens, and this is related to the human leukocyte gene, which affects the presentation of beta cell antigens. So, let's pretend that this little square is our normal antigen and the triangle is the foreign antigen. So your body recognizes that as foreign and it will attack it. And this is triggered by viruses or toxoids. So there's two types of diabetes type 1. There is type 1A and there's type 1B. Type 1A is autoimmune related and type 1B is idiopathic or unknown. So now let's draw a little graph here. So we have time and we have the normal range and the hypoglycemic range. So basically your beta cell count is going to fall while your T cell mass rises, and usually you go into hypoglycemia when about 70 to 90% of your beta cells are destroyed. So your insulin levels are going to decrease as well, and you also have a little honeymoon phase. This is basically just a small phase of remission. However, you're eventually going to need to have treatment after this because you won't have any insulin or beta cells left. So signs and symptoms of diabetes mellitus 1. So there's classic symptoms, which is polyuria, polydipsia, and polyphagia. So basically in polyuria and polydipsia, your cell is drawing water out of your cells to dilute the blood with all that glucose. So you're going to have to pee more because you have a higher blood volume and you're going to be more thirsty. You're going to have polyphagia because there's no energy for your cells to have, so it's going to drive your hunger. And that can also relate to fatigue because you have no energy. You also can have ketone breath, which is fruity breath, and that's due to diabetic ketoacidosis, blurred vision, which is due to retinopathy, and weight loss because your body uses fat rather than glucose as your main energy source. So, diagnostic tests. You have your A1C glucose hemoglobin test. You have your random blood glucose test. You have your fasting glucose test, and you have your oral glucose tolerance test. These values on the side are what would be considered the diagnostic norm, but as you can see on the side, that normal is actually quite lower than those lab values. So some potential complications include diabetic ketoacidosis, where basically your blood becomes acidic and you go into metabolic acidosis. You can have hypoglycemia where your insulin and glucose are imbalanced, infection because your white blood cells can't mobilize, so there's not a good response to infection. Some vascular complications, so because your glucose is so sticky in those smaller vessels, it's going to get stuck, and that's going to compromise blood flow. So you can have macrovascular issues and microvascular issues. This can result in ulcers, retinopathy, and nephropathy, because those are very small vessels that you're going to in your skin, eyes, and kidneys. And then you can also have neuropathy, which can also contribute to diabetic ulcers, and if not treated, it can result in amputation. So, treatment and nursing intervention. So your goals of care are going to be promote well-being, facilitate self-management and safety of the patient, decrease likelihood of any complications, and primarily hyper and hypoglycemia. Now, your education is going to be key in nursing management because this is a lifelong disease and it's important for both patients and their children to be educated. So for your treatment, so the first kind of treatment that is primary is drug therapy. So this is administration of exogenous insulin, and this can be through subcutaneous injections or insulin pumps. So with your subcutaneous injections, you can see I'm drawing the various insulin sites that you can administer the subcutaneous injections. However, the abdomen is going to be the most preferred because it has a higher rate of absorption. The insulin pump, it's basically a little machine that's attached to the patient, and it's a continuous infusion of insulin into the body. Both need constant blood glucose monitoring to ensure that the therapy is safe. So there are four primary insulin types, and there's a little acronym here that we can show. So there's rapid, short, humulin, or intermediate, and long. And so you can see rapid is very short, short is moderately short, intermediate lasts a while, and long goes and has no peak. There's also nutritional therapy. So your food intake has to equal your energy output. And you should be doing carb counting as well as glycemic index use, and this allows your food intake to coincide with insulin administration so one doesn't become hypoglycemic or hyperglycemic. Next, exercise. So insulin receptor sites can be increased and more sensitive to insulin when you exercise, and this is going to result in lower blood glucose levels as well as maintenance of normal weight. It is important to have snacks and to monitor your blood glucose before, during, and after exercise, just so you can avoid any hypoglycemic episodes.
Also, continuous blood glucose monitoring is very important because you want to stay in that range because you don't want to have hypoglycemia or hyperglycemia, and it's important because it'll monitor the efficacy of your treatment. So, how do you know your nursing intervention was effective? So, the patient's going to know how to self-manage and what to do in case of any episodes. They're going to know how to carb count, do blood glucose monitoring and insulin administration properly, a balanced diet, family support, and good immune status. They can identify any injuries or sores, and they will basically have all overall health benefits, and affordability of medication won't be an issue.
That concludes our video. Thank you so much for watching. Bye.